Coffee, despite its popularity and health benefits, can have negative effects on the body under certain conditions. It is important to know that its consumption can worsen symptoms or increase the risk of blood clots, varicose veins, arrhythmia, stroke, cirrhosis, or liver cancer, lead to kidney failure and stone formation, increase inflammation of the pancreas, which is associated with an increased risk of pancreatitis and pancreatic cancer, asthma, osteoporosis, and many other problems. Let's take a look at 10 health conditions where you should not drink coffee, based on research and doctors' recommendations. This video will be extremely informative and helpful. So if you want to become a master of your health, click like and let's get started. Number 1. Heart problems. Caffeine, the main active ingredient in coffee, is a powerful central nervous system stimulant. It has several effects on the cardiovascular system that can be especially dangerous for people with pre-existing heart problems. Caffeine can cause changes in heart rhythm, which manifests as arrhythmias, irregular heart rhythms, and rapid heartbeat, tachycardia. These conditions can be especially dangerous for people with pre-existing arrhythmias or heart abnormalities, as caffeine increases the possibility of them occurring and worsens their course. Regular caffeine consumption can increase the likelihood of developing heart conditions such as coronary heart disease and heart failure. This is due to the increase in blood pressure and heart rate under the influence of caffeine. Studies show that caffeine can cause changes in the structure and function of the heart muscle, impairing its performance and ability to adapt during exercise. Caffeine may interact with medications prescribed to treat heart disease, enhancing or weakening their effects. This can lead to unwanted side effects or reduced effectiveness of treatment. Therefore, it is recommended that people with pre-existing heart problems or an increased risk of heart disease discuss with their doctor the possibility of limiting or avoiding caffeine intake altogether. This can help reduce the likelihood of heart complications and improve overall health. Number 2. Hypertension. High blood pressure is a serious condition that requires monitoring and management to prevent cardiovascular complications. Caffeine, a major component of coffee, can have a negative effect on blood pressure levels and the overall health of hypertensive patients. Caffeine stimulates the release of adrenaline and increases central nervous system activity, leading to a temporary increase in blood pressure. This effect is especially noticeable in people already suffering from hypertension and can increase the risk of heart attacks, strokes, and other cardiovascular complications. Constant caffeine consumption in individuals with hypertension can lead to prolonged elevation of blood pressure, which in turn increases the risk of cardiovascular diseases such as coronary heart disease, arrhythmias, and heart failure. Caffeine has weak diuretic properties, which contributes to a temporary increase in urine excretion. In individuals with hypertension, this can lead to additional strain on the kidneys and an increase in circulating blood volume, which is not desirable for people with high blood pressure. Caffeine may interact with medications used to lower blood pressure, altering their effectiveness or causing unwanted side effects. This can lead to poorer hypertension control in patients who consume caffeine regularly. Based on these factors, it is recommended that people with hypertension discuss with their doctor the possibility of limiting or completely avoiding caffeine. This can help reduce the risk of cardiovascular complications, improve treatment efficacy, and overall health. Number 3. Circulatory System Problems. Problems with the circulatory system include a variety of conditions related to circulation and cardiovascular function. Caffeine, the active ingredient in coffee, can have a negative effect on these systems, especially in people with pre-existing problems. Caffeine can stimulate blood coagulation and increase the formation of blood clots in blood vessels. This is especially dangerous for people with impaired circulation, atherosclerosis, or other vascular diseases, as increased clotting can lead to serious complications, including heart attacks and strokes. Coffee consumption can exacerbate symptoms of vascular diseases such as varicose veins or chronic venous insufficiency. Caffeine promotes vasoconstriction, which can impede normal blood flow and increase swelling and pain in patients with these conditions. Based on these factors, it is recommended that people with circulatory problems such as atherosclerosis, varicose veins, or other vascular diseases discuss the possibility of limiting or avoiding caffeine altogether with their doctor. This can help reduce the risk of clotting, improve circulation, and overall cardiovascular health. Number 4. Liver problems. The liver is an organ that plays a key role in metabolism, detoxification, and energy storage. In people with liver disease such as cirrhosis, hepatitis, or fatty liver disease, the function of this organ can be impaired. Coffee consumption can exacerbate these problems, and here's why. The liver metabolizes caffeine, and this process can be impaired in people with liver disease. Disrupted caffeine metabolism can cause caffeine to build up in the body, which can cause toxic effects. Increased caffeine intake can increase the burden on the liver, forcing it to work harder to detoxify and metabolize substances. This can worsen liver health, especially if liver function is already impaired. Some studies show that caffeine can increase inflammation in the body. In people with chronic inflammatory liver disease such as hepatitis, it can exacerbate inflammation and accelerate disease progression. Caffeine can promote fibrosis, scar tissue formation, in the liver. In people with pre-existing fibrosis or cirrhosis, it can accelerate the deterioration of organ function and lead to more serious complications. In cirrhosis, liver tissue is replaced by scar tissue, which significantly reduces liver function. Caffeine can exacerbate this process by contributing to further damage to liver tissue. Caffeine can cause or worsen symptoms such as heartburn and digestive disorders that often accompany liver disease. People with liver disease often experience a general decline in health and fatigue. Caffeine can exacerbate these symptoms, causing nervousness and sleep disturbances. People with liver disease should consult a doctor about coffee consumption. Your doctor may recommend limiting or eliminating caffeine from your diet to reduce the strain on your liver and prevent liver damage. Number 5. Kidney problems. The kidneys perform vital functions including filtering blood, eliminating toxins, and regulating water and electrolyte balance. In people with kidney disease, such as chronic kidney failure, pyelonephritis, or glomerulonephritis, the function of these organs can be impaired. Coffee consumption can exacerbate these problems, and here's why. The kidneys play a key role in eliminating caffeine from the body. In people with kidney disease, this process can be impaired, leading to a buildup of caffeine and its metabolites in the blood, increasing the toxic load on the kidneys. Caffeine is a diuretic, meaning it helps increase urine excretion. This can increase the burden on the kidneys, especially if their function is already impaired. Caffeine can raise blood pressure, which is a significant risk factor for people with kidney disease. Elevated blood pressure can accelerate the progression of kidney failure and cause additional complications. Elevated blood pressure increases the strain on the kidney vessels, which can cause damage to them and impair kidney filtration function. Caffeine can increase calcium levels in the urine, which contributes to the formation of kidney stones. People with pre-existing kidney stones or a tendency to form them are advised to avoid coffee to reduce the risk of exacerbating the condition. Caffeine increases urine excretion, which can lead to dehydration and impaired water electrolyte balance. This is especially dangerous for people with chronic kidney disease, as their ability to regulate this balance may already be compromised. Increased urine excretion can lead to the loss of important electrolytes such as sodium, potassium, and magnesium, which can worsen overall health and kidney function. Caffeine can increase inflammation in the body. In people with inflammatory kidney disease, such as glomerulonephritis, it can exacerbate inflammation and accelerate disease progression. Medical advice. People with kidney disease should consult a doctor about coffee consumption. The doctor may recommend limiting or completely eliminating caffeine from the diet to reduce the strain on the kidneys and prevent their condition from worsening. Number 6. Pancreas problems. The pancreas plays a critical role in digestion and blood sugar regulation. Diseases of the pancreas, such as pancreatitis or pancreatic cancer, can significantly impair these functions. Coffee consumption can exacerbate pancreatic problems for several reasons. Caffeine stimulates the production of gastric juice, which can irritate the pancreas and increase inflammation. This is especially important for people with chronic pancreatitis, as additional irritation can cause painful attacks and worsen the condition. Caffeine can also stimulate bile secretion, which can contribute to the development of biliary pancreatitis in people with gallbladder or biliary tract problems. Caffeine can increase inflammation in the body, which is especially critical for people with chronic pancreatitis. Inflammation of the pancreas can lead to destruction of the gland's tissue and impairment of its functions, including the production of insulin and digestive enzymes. Caffeine can contribute to increased oxidative stress in the pancreas, which can worsen its condition and contribute to disease progression. Coffee consumption may increase the risk of acute pancreatitis, especially in people predisposed to the disease. This is due to the irritating effect of caffeine on the pancreas and biliary tract. For people with chronic pancreatitis, coffee consumption may increase the frequency and severity of recurrences of the disease due to the constant irritation and inflammation of the pancreas. The pancreas produces enzymes needed to digest food. Coffee consumption can interfere with the normal function of the gland and reduce the production of these enzymes, leading to problems with the digestion of nutrients such as fats and proteins. The pancreas produces insulin, which regulates blood sugar levels. Caffeine can affect insulin sensitivity and impair its secretion, which is especially dangerous for people with or predisposed to diabetes. Medical advice. People with pancreatic disease should consult a doctor about coffee consumption. Your doctor may recommend eliminating caffeine from your diet completely or significantly limiting caffeine intake to reduce the risk of exacerbation of disease and to maintain pancreatic health. Number 7. Gallstone disease. Gallstone disease, cholelithiasis, is characterized by the formation of gallstones in the gallbladder, which can cause pain, inflammation, and other complications. Coffee consumption can worsen symptoms and exacerbate the disease for several reasons. Caffeine stimulates the release of bile from the gallbladder. This can cause gallstones to move, which can cause pain and even blockage of the bile ducts. Blockage of the ducts can cause cholecystitis, inflammation of the gallbladder, and pancreatitis, inflammation of the pancreas. Increased bile secretion can trigger biliary colic, severe pain caused by the movement of gallstones in the bile ducts. Caffeine can cause spasms of smooth muscles, including the muscles of the biliary tract. This can impede the flow of bile and worsen the symptoms of gallstone disease. Spasms can increase pressure inside the gallbladder, which can lead to pain and inflammation. Caffeine can contribute to inflammation in the body. In people with chronic cholecystitis, inflammation of the gallbladder, drinking coffee can worsen inflammation and cause the disease to worsen. People with chronic cholecystitis may experience recurrences of gallbladder inflammation when drinking coffee due to its stimulatory effect on bile formation and biliary secretion. Bile is necessary for emulsification and digestion of fats in the digestive system. When bile flow is impaired due to spasms or stone movement, digestion of fats may be impeded, leading to dyspeptic phenomena such as bloating, abdominal pain, and diarrhea. Chronic biliary dysfunction can lead to poor absorption of fat-soluble vitamins, negatively affecting overall health. Medical advice. People with gallstone disease are recommended to avoid drinking coffee. It is especially important to exclude caffeine-containing drinks during exacerbations of the disease or in the presence of acute symptoms. Consult a doctor. Before making any changes to the diet, it is necessary to consult a doctor who can make individual recommendations based on the patient's condition and the degree of disease progression. Monitor diet. A doctor may recommend a diet rich in fiber and low in fat to keep the gallbladder healthy and minimize the risk of new stone formation. Number 8. Digestive problems. Digestive problems can range from gastroesophageal reflux disease, GERD, to irritable bowel syndrome, IBS, to stomach ulcers. Coffee, as a stimulating beverage with acidic properties, can aggravate these conditions, causing unpleasant symptoms and worsening overall health. Gastroesophageal reflux disease, GERD. Coffee increases acidity levels in the stomach, which can promote acid reflux into the esophagus, causing heartburn and other symptoms of GERD. Caffeine weakens the tone of the lower esophageal sphincter, a valve that prevents acid from the stomach from entering the esophagus. This weakening increases the likelihood of reflux and heartburn. Irritable bowel syndrome, IBS. Caffeine stimulates intestinal peristalsis, which can worsen IBS symptoms such as diarrhea, abdominal pain, and cramping. In people with IBS, especially those with an inflammatory component, coffee can increase inflammation and irritation of the intestinal mucosa, gastric and duodenal ulcers. Coffee stimulates the production of gastric juice, which can worsen ulcer conditions by causing pain and slowing the healing process. Coffee, especially on an empty stomach, can irritate the mucous membrane of the stomach and duodenum, worsening ulcer symptoms. Coffee can increase inflammation of the gastric mucosa in people with gastritis, leading to pain, heartburn, and a feeling of heaviness in the stomach. Caffeine can interfere with the repair of the gastric mucosa, which worsens the course of gastritis and slows the healing process. Dyspepsia, digestive upset. Coffee can cause symptoms of dyspepsia such as nausea, abdominal bloating, pain in the upper abdomen, and a feeling of fullness. Deterioration of peristalsis. Caffeine stimulates the stomach and intestines, which can cause cramping and pain, especially in people with sensitive digestive tracts. Medical advice. People with digestive problems are advised to avoid coffee, especially during periods of worsening symptoms, to reduce the strain on the digestive system and reduce the risk of complications. Switch to alternative beverages. Instead of coffee, you can use herbal teas or decaffeinated drinks that do not irritate the mucous membranes of the stomach and intestines. Consult a doctor. It is important to discuss any changes in diet with a doctor who can make individualized recommendations based on the patient's specific condition. Maintain a healthy lifestyle. Following a healthy lifestyle, including proper nutrition and moderate exercise, can help manage digestive symptoms. Number 9. Respiratory system problems. Problems with the respiratory system can significantly impair quality of life and require special attention to diet and lifestyle. Coffee, despite its stimulating properties, can negatively affect people with lung and respiratory problems. Let's take a look at how coffee affects the respiratory system and why it should be avoided for certain conditions. Caffeine, the main active ingredient in coffee, is a central nervous system stimulant. This can lead to increased breathing and increased stress on the lungs, especially in people with chronic respiratory conditions such as asthma or chronic obstructive pulmonary disease, COPD. This condition includes two main components: chronic bronchitis and emphysema. An increase in breathing rate can cause hyperventilation, which results in decreased levels of carbon dioxide in the blood and can cause dizziness and anxiety. In some people with asthma, coffee can provoke inflammatory reactions in the airways, which can worsen asthma symptoms such as wheezing and shortness of breath. Caffeine can increase allergic reactions, which can also contribute to airway inflammation and irritation. Caffeine has a diuretic effect, which can lead to dehydration. Dehydration can thicken mucus in the airways, making it less mobile and making breathing more difficult. In chronic lung diseases such as COPD, dehydration can worsen coughing and make it harder to expel sputum. Caffeine can increase levels of cortisol, a stress hormone that in high concentrations can suppress the immune system and worsen inflammation, especially in the airways. Medical advice. People with respiratory system problems are advised to limit or avoid coffee consumption. This is especially important for those with asthma, COPD, or other chronic lung diseases. Ensure adequate fluid intake to prevent dehydration and keep mucus in the airways moving. Choose alternative beverages. For example, herbal teas or caffeine-free beverages that do not have stimulant and diuretic properties. Consult a doctor. Discuss possible changes in diet and the effects of coffee on the respiratory system. Number 10. Bone problems. Bone problems such as osteoporosis and osteopenia often require special attention to diet and lifestyle. Coffee, despite its positive qualities, can have negative effects on bone health, especially in people with pre-existing problems. Let's take a look at how coffee affects bones and why it should be avoided. The caffeine in coffee can interfere with the absorption of calcium and magnesium, important for bone formation and maintenance. Deficiencies in these minerals can lead to decreased bone density and an increased risk of fractures. Caffeine increases calcium excretion through the urine, which may further contribute to a decrease in bone calcium. In postmenopausal women, who naturally have decreased bone density due to decreased estrogen levels, coffee may exacerbate bone mass loss and increase the risk of osteoporosis. Older adults, whose bones naturally become more fragile as they age, are particularly susceptible to the negative effects of caffeine on bone health. Caffeine can increase levels of cortisol, a stress hormone that, in large amounts, can promote bone breakdown and inhibit bone repair. Increased parathyroid hormone levels due to caffeine exposure can lead to the release of calcium from the bones into the bloodstream, which also weakens bone structure. Caffeine can interfere with the metabolism of vitamin D, which is necessary for calcium absorption. Vitamin D deficiency leads to a decrease in the amount of calcium available to bone tissue. Medical recommendations. People with bone problems are advised to avoid or limit coffee intake, especially vulnerable groups such as the elderly and postmenopausal women, to reduce the risk of bone loss and fractures. Ensure adequate calcium and vitamin D intake through diet or supplementation to offset the possible negative effects of caffeine on their absorption. Choose alternative beverages. Caffeine-free beverages such as herbal teas, which do not affect bone metabolism, can be consumed instead of coffee. Consult your doctor. Discuss any changes in coffee consumption and possible calcium and vitamin D supplements to maintain bone health. Conclusion. After reviewing the 10 health conditions where you should refrain from drinking coffee, we see that it can exacerbate symptoms and cause discomfort in people with a variety of health conditions. By avoiding coffee consumption in such cases, you can reduce the risk of unwanted health effects. Remember that your doctor's individualized recommendations play a key role in maintaining your health and well-being. What do you think about this issue? Do you agree with these statements? If you have any questions, ask them in the comments. More information on this topic can be found in the links in the description below this video and on our channel.
Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.